Haha, I made it on time. I like when I make it on time. Today is Tuesday. I hope everybody had a good Tuesday. Tonight we are talking about the hiring process and some of the things to expect when you are in the hiring process as a medical coder. Hi Tawana, hi CB, thank you for joining me. Hi Christina, thank you for joining me. All right, so a lot of questions about the hiring process. What are some of the things that are like expected? What is normal? Background checks. Is there a credit check? That kind of thing. So we're going to be talking about that today. The vaccination question. I'm going to talk about that too. I will tell you guys that these are a lot of the things that I remember from when I was getting hired on. So this is a lot of the stuff that I've gone through myself personally. And some of the things that I know that other places do or they call upon for their company and stuff. So just some things to be aware of. Hi Tangela, thank you for joining me. I see some blue hearts. It's delaying getting over here. Hi Sandra, thank you so much for joining me. Thank you for all the blue hearts. All right, so yesterday was the review of the book. And tomorrow will be the first day of Vlogmas. I hope you guys don't get sick of me. It's going to be 25 days of modifiers. So lots and lots of modifiers and lots of really good information. Hopefully it will help you to understand modifiers better. So be on the lookout for that. All right, so let's go ahead and get started. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight, I am talking about the hiring process for a medical coder. What are some of the things that you should expect if they are hiring you or if they are in processing you, right? And that's what I'm going to talk about tonight, Tawana. I don't know specifically because every place is going to be different, but they are okay. So her question is, what kind of tests? I have to be very sensitive about what I'm saying because YouTube doesn't like a lot of words. But is there if you're taking a substance test, right? Is there a substance test? Yes, there is. Out of all the jobs I've ever had, I've always been sent for a substance test. Now, the thing is, a lot of people say, well, I have to have this substance because it helps me with my nerves and things like that. It doesn't matter to these guys. It really doesn't. When it comes to this line of work, you have to be lucid and you have to be with it. And you cannot be under the influence when you are working in this kind of work because it requires us to have full and complete concentration and full cognitive workings because we are looking at medical record documentation. We are selecting procedure codes. We are selecting diagnosis codes that will follow patients everywhere. So do be prepared for this. Sometimes people will say, well, I'm on a medication that comes up as this, right? When you take these substance tests. And you have to, I mean, if that's the case, then, I know you don't have to disclose things to your employer, but something like that, you don't want it to have the wrong idea that you are on something when you're not. It's a medication, so that might be something that you would want to say. So that is something that I'm just putting out there. You don't have to take my advice, but I'm just saying. But that is the way that it is. That there is zero tolerance for this. When you're working in healthcare work, in the healthcare field, there is zero tolerance for any foolery when it comes to substances that are like that. Okay, so I will put that out there. But yes, they do those tests. Not all places, because I have seen some that they say, well, they don't do a test here. But you'd have to do your research on that one, because every place that I've ever worked at, including the temp agency, did run a substance test. As far as background checks, they are looking for criminal activity. That is what they're looking for. If you have a bit of a checkered past, you have to be honest, because they're going to find it anyway. And depending on how far back it is, that's also another thing you have to remember. But for the most part, a lot of places are running like 10 years back. And typically that's how far back that your resume should go as well, because that's typically how far back they run your background. So they are looking for violence. They're looking for any kind of problems that would be problematic for the workplace. And then also if you have like identity theft, that's a no-no. That's immediately going to, take you out of the running, because that is not tolerated. We have to have a HIPAA at all times. And if you've had a problem before, this is not the field for you, because they're going to find it and you're not going to get hired. So that is something that you should know. They will run you. I've been run many times. And sometimes you have to go to the police department to pull your record, essentially, just to make sure that you don't have anything. I've had to do that before too. They wanted to make sure I didn't have anything outstanding, no outstanding warrants, because when you go to the police station, I think you can do that. And at least that's what I remember. It's been a while back since I had to do that. But yeah, you have to go in and show that. So depending where you are working, because if you're working for a hospital, and particularly a large hospital, you're going to see that kind of security when it comes to your background checks. And for some, if they're working like in doctor's offices, it's going to be like a small business. So it really is going to depend. And I think like the bigger the facility, the more in depth the background check might go, because I think as in depth as it gets, it can get more expensive. So, Zaida, I just want to complete the test to finish the hiring process. Today I had my first day. Thank you for all your interview tips. That is so great. Congratulations. Hi, Cray Cray. Thank you for joining me. We are talking about the hiring process right now. So let me continue on with the subject. If you're asking me my opinion, Cray, no. That's something that's not a, for some states, that's legal, right? Again, I'm being very cryptic in the things that I say, because YouTube doesn't like a lot of stuff. So you guys know what I'm talking about. Some states that is acceptable, and it's fine. But when you start working in a field like healthcare, that is something that even if it's okay in that state, it may not necessarily be okay with that employer. So look at the state of Colorado. There's a lot of those that are like that in Colorado, where, yeah, it's legal in the state, but, for certain employers, in particular like large hospitals, they're like, no, you can't do that. Because again, you have to have full mental capacity when you are working with these records. You have to be able to pay attention. You have to be able to do all these things. And yes, while you may do this on the weekend and it may be something that you do for recreation, it still has the ability to be able to impair you. It is like when you are drinking, right? And sometimes people will try to go to work the next day and they're not right? They're not able to concentrate. That's not the time to be at work. You can't do that. So I hope you guys don't get sensitive about the things that I say. I'm just giving you guys the real deal here. And for sometimes people are just like, well, Blue, I think if I did this, I think you don't have to explain to me what you want to do or what you're going to try to do. I'm not the one who has to try to work in the job, right? But that's what this field is. That's what this field is going to require, is that you have full working knowledge at all times and nothing that is going to cloud your judgment. Okay. Thank you for the blue heart, Tawana. But yes, so moving on. You do have to get fingerprinted sometimes. I've gotten fingerprinted myself. I think that was why I also went to the police station to get fingerprinted. Because you have a card that you bring with you when they run the background check. And so that was where I had to have it done. I believe that's where it was. Yes. But yeah, that was part of the process too. So we get put into a database also. So in case something happens, if you have a HIPAA violation, it's going to show. Because when you are working, wherever you're working, they have to have security and they have to be able to protect these patients' records. If you get something like a HIPAA violation, you can kiss your career goodbye, because that is, again, it's not tolerated. When it comes to this line of work, we have access to so much sensitive information. Think about it. I mean, it is literally somebody's life that you are coding for when you are coding as a medical coder. You're welcome, Cray. But yes, so that is what I would have to say about that. Of course, you will have to take a skills test. That is not uncommon. And you will be on a probation period when you are starting in the beginning. Typically, it is 90 days. I've seen some that was 6 months that they're going to give you, but they're going to expect you to, get up to speed in that certain amount of time. So if it's 90 days, and again, I've been on 90-day probation quite a bit. And what they do is they make sure that you're meeting all the standards and the metrics as you're going along. You are improving on your production speed and you're improving on your accuracy. And that is very important. If you're not, they should try to work with you, because it is so much work just to get you hired, right? Think about all the steps that you got to go through. So that's the thing when you're starting brand new. So look at that. I should probably go back. Your references. Whenever you put down a reference, make sure this person will speak highly of you. If you are putting down a reference that, they can't really say anything against you, especially if you are putting down a former supervisor. They can't really say anything against you that, this person shouldn't be hired because of this, X, Y, Z. A lot of times when people are calling these references for employment verification, they're calling HR and they'll just ask, was this person employed there, how long, and were they full-time, part-time? That's what they do when they're verifying employment. But for your personal references or your professional references, make sure that it is somebody that knows that you are putting them down as a personal or professional reference, and they will call. Trust me, I've had many that I've put down as professional references and personal references, and they say, oh yeah, I got a call. My stepdad got actually a couple calls, and he was like, yeah, they called and they were asking me about you, were you a trustworthy person? And I was like, oh, okay. But yeah, so that is what they do when they are calling for those references. They will call. So just make sure that it's somebody that you can trust, and somebody that knows you, somebody that knows your character. So that is very important. And if it's a professional reference, it's somebody that you worked with well. Again, I wouldn't put somebody on there that was a bad supervisor for me. Heck no. Because why would I do that? That person already has a history with me that is not so good. So I would want somebody that is going to be professional, that was mature at the time and things like that. So that's what I would do. Hi, A. Thank you for joining me. Cray says, I recently saw an article that Kaiser was caught intentionally coding Medicare members incorrectly to save money. If something like this were to happen where the employer is making you code wrong. See, that's the thing. We have ethical standards that even if they're telling you that it's wrong, we cannot code incorrectly just because the employer says. We have ethical standards, and the ethical standards for medical coding is by Ahima, right? And whether you are AAPC certified or Ahima certified, everybody falls under the Ahima standards of ethical coding. So you will code properly. If you do not code properly, that is on you. That is your credentials that can get taken away. It is you that could end up doing time. So let me tell you guys a little story. So a few weeks ago, I saw an article. It was posted on LinkedIn, It was a optometrist, right? Who was his wife did the billing for their business, right? For their optometry practice. And so the doctor, the optometrist, ended up getting a fine. His wife ended up going to jail for 3 years because she was submitting the bills incorrectly. She was, whatever they were doing, whether it was upcoding or undercoding, she got busted for it. So she has to do the 3 years, not him. He only gets the fine. So at the end of the day, whatever you put your name on, you have to be willing to say, okay, this is the reason that I did it. This is what I have to support what I did, and this is why I'm doing this. So again, if you're being instructed to code it incorrectly, that's not on the person that's instructing you to encode it incorrectly. It is on you. So you would be the one that would be in trouble, not your supervisor or not your team lead or not, whatever. And before anybody says anything, facilities do have sometimes their own rules installed. Now that is fine because there are some things, there's like extra information that needs to be picked up that would not normally need to be picked up, right? Because for whatever reason, let's just say tobacco use, right? Tobacco use. And for informational purposes, the facility wants everybody who smokes or who does dip and vape and all this other stuff, they want all of that information captured in the record for all patients. So that is something that everybody would code because that is a facility-driven mark. You know what I mean? Like they want you to do that, and that is fine. But intentionally undercoding or intentionally overcoding is not an excuse. And even if you didn't know, it's still not an excuse. Now, yes, there's mistakes and okay, oops, we'll go back and correct it. And it'll either be an audit from the insurance company or it will be a self-audit, and then basically you turn yourself in. Well, the hospital turns itself in, kind of like, I know that sounds weird to say, right? But they will be like, okay, yes, we made a mistake. We made an error here. So we're going to give you back your money. So whatever the case may be, they work it out. But intentional fraud like that, you can end up in jail. You can have your credentials taken away. Absolutely. Because you are the coder. And for some people, they don't know this, especially getting in like, really, I'm responsible? Yes. This is why I tell you guys that y'all need to study and you need to read. Yes, there are things that we are learning as we go along, and that's fine. But again, that's why we have to know and be able to comprehend a lot of these things. So for my folks that are saying, well, Bleu, English is not my first language, it's not an excuse. Because at the end of the day, that bill is going to go out to that patient. That insurance company is going to pay. That hospital is going to get paid. But if they have to pay that money back, what is the sense? So who do you tell? Well, you can report it. There's lots of information you can report to the OIG, the Office of the Inspector General. You can also report it there. But you can Google a lot of that information as well. Tawana, this is my second week of coding school. So far, so good. I am going for my CPC, but I only have experience as a medical assistant. Will that help me get employment in coding? I'll come back to that. Hi, Mindy. I'm doing great. Thank you for asking. CB, what if you've been out of work for a while? What do you mean, like you haven't worked, or you're asking about employment gaps on your resume? Is that what you're asking, CB? Hi, Barkeisha. Barkeisha says, hi, Bleu. I just wanted to let you know that I got the medical billing job through the temp agency. Had the interview today, and they called me later this evening. I start next week. You hear that? You hear that, everybody? For those that are in the back that did not hear, Barkeisha got her first job through the temp agency. She took my advice, went to the temp agency, and now look, now she has a job. So for those that were turning their nose up at the temp agency, I'm just saying, she's got a job. Congratulations, Barkeisha. That is wonderful. That is wonderful, and I am so happy for you. Congratulations. Tangela, I am going to be transferred at my current employment, but I feel as if I'm being hindered Once I told my supervisor I was certified, I got rejected for coding position I applied for. Why do people gotta be petty? Especially supervisors. Why are you so threatened when somebody wants to grow? When somebody gets a certification? If you want a certification, then go to coding school or study on your own and get your own certification. Don't be lazy and don't try to hold other people down. I never understand that. But again, it goes back to that expression. You know how they say nurses eat their young? It's the same thing with medical coders. Unfortunately, I am not that way. But again, every person is going to be different. Every medical coder is going to be different. But for some reason, those ones that get into those positions like that, sometimes they do that, unfortunately. But that tells you right there that maybe that place is not for you, that there's something better for you. There's another place that's going to pay you more money. You're not going to have that drama. You're not going to have all those bad things and that bad energy around you. So that's just something that you can think about. You know, I've had a client who went through that very same thing. We did a resume review together. I rewrote her resume. She got an even better job. But she had that same thing because she was trying to transfer within her hospital and they didn't want to let her transfer. And so she ended up finding a better place that paid her more money. So that is something that, you know, maybe you should think about. I know it's hard, especially if you put in the time with that facility. You're like, really? I spent all these years and, you know, here I'm just trying to, you know, move around. And sometimes HR doesn't help, you know. It really all depends on the HR department that it's at that place, because some HR departments are really good and some are not. So, you know, it depends. Oh, employment gaps. Okay, we'll get that to that. And you're welcome, Parkeisha. All right, so what if you've been out of work for a while? If you have an employment gap, right? Say you worked 10 years ago, and for example, you've been raising children for the last 5 or 10 years, right? And you say, well, Blue, I haven't worked. And the last thing that I did was I worked at the Dollar General. I know I always say Dollar General, but it's just easier, right? Or I could say Wendy's. Wendy's is good too. Last time I worked at Wendy's. Okay, what did you do at Wendy's? Well, I was a team lead, and I was a cashier. I was a line cook and things like that. Okay, great. You also have money handling experience, which comes in handy if you are going to apply for a medical biller experience, right? Or a medical biller job. You have customer service experience because you've been dealing with all kinds of customers, hangry customers, customers, you know, different backgrounds and things like that. So you're able to work with the public, right? So that's another skill. So think about that job and all the transferable skills. When I was a team lead, I had to schedule people's times to come in and things like that. Okay, so you did scheduling for the staff. Okay, how many staff did you do this for? Okay, there was 16 crew members. Okay, so you manage the schedules for 16 crew members. Okay, so that also means that you know how to organize and you know how to work with time and things like that. You know how to work with reports. Again, that is a transferable skill that we need as medical coders, is somebody that can, you know, work with time and work with organizational skills. So think about everything that you had at that job, and no matter what it was, whether it was working at Wendy's or working at Dollar General, there are transferable skills that you could put on your resume. It doesn't matter that there was a gap, because that is what your cover letter is going to be able to explain. Again, like I said a few nights ago, majority of medical coders are women. Because of this, there's a lot of mothers. And a lot of times people think, well, you know, I haven't worked in years and, you know, I don't know if I can get hired. Yes, you can, because again, we're full of mothers. Mothers understand. So even if you're talking about on your cover letter that you had spent time raising children, they're going to understand. Okay, she doesn't have little children at the house anymore, or they're big enough to start going to school. So this person is going to be more available for us here at the workplace. So again, don't be afraid of a gap in your work history, because you do have skills somewhere. You have some transferable skill in the job that you came from. If you worked at Dollar General, maybe you had to work with Excel spreadsheets, like when you were doing inventory and things like that. Again, Excel, working with Excel is something that medical coders do need, because we do work with reports. Now, they may be complex reports, but they may be very simple workload type reports. And I work with a very simple workload type report. So again, that is a transferable skill that I have on my resume. So don't ever discount anything that you did in the past as far as like your jobs and things like that. Well, that's not really going to do anything. It could. Start looking at it. Then look at the job posting for the medical coder position that you want, right? And see if there's anything on there that you've done before. Now, your training, again, your training's got to be all over that resume. That training has to dominate on your resume, because that is what you learned. That is all the skills that you need. They need to be able to focus on that. Don't make them focus on the fact that you haven't been working in 5 or 10 years. That doesn't matter, right? What matters is what you were trained in. Okay, let's start looking at the shiny things now. Medical terminology, anatomy and pathophysiology. And what did you learn? Icd-10-Cm. You guys better be clear on that. Because if I see ICD or ICD-10, I'm going to flip my lid. Because there's Icd-10-Cm and Icd-10-PCS, two completely different things. Do not assume that the employer knows what you're talking about, because not everybody gets Icd-10-PCS training, right, when you first start as a medical coder. Because if you're in school, sometimes you are in these programs that are just training for the outpatient side, which is a lot easier to train brand new people just starting. And then if you have an advanced program, or if you're studying on your own and you start learning the inpatient side of the house, that's another skill. So if you have Icd-10-Cm training, the diagnosis training, you need to put that down completely. Icd-10-Cm. Do not try to abbreviate it, guys. You have to write it out, Icd-10-Cm, because if you try to abbreviate it, they're not going to know. And then when these resumes are being run through these word finders programs, they're going to see that it's incomplete, and they're going to discount you. So don't make yourself discounted, right? Make sure that you put it down in full. Icd-10-Cm, CPT, HCPCS level 2. And then you're going to put all of your other training, the things that you know. Microsoft Office. Do you know Outlook, Word, Excel, PowerPoint? If you don't know PowerPoint, that's all right. There's plenty of tutorials all over YouTube. But at least if you have Word, Excel, and Outlook, you're great. Okay, that's email. That's the Word program, which is very easy. And you have Excel again, which is not very hard, and there are tutorials on YouTube for that. If you're able to speak more than one language fluently, you need to put that down. Why would you have to know multiple languages when you are a medical coder? You don't know if having the ability to be able to speak multiple languages is going to put you ahead of the pack, right? You have to be able to stand out, folks. And just because you haven't been working in a few years, it's not going to count you out. Okay, it may look like, oh, I don't know, but don't let that count you out. You got to be able to show your skill. If you are fluent in Spanish and you can read and write it, or even if you can just speak it fluently, but maybe not write it, you need to be very clear on your resume. Language fluency. If it is just English, that's fine. Because if you look at these job postings, it does say candidate must be able to write and speak English fluently. Listen to them. That's a skill that you possess. If you can read and write English very well, you need to put that down, because what they're looking for is somebody that can clearly communicate. Because you would be surprised about how many people do not like to write. And I don't know if it is a generational thing or because we're all on computers now. But I would think that would be much easier, because we have all these software programs that you can go through to make your writing a lot easier. There's a lot of them out there. So that would be something that you can write on there. Language proficiency, English, written and verbal. So there you go. That's another skill that you have on your resume. And that's what you're going to be highlighting. Not the fact that this is your first job, not the fact that you are a team player, because everybody's a team player. Okay, so don't do that to yourself. You got to be able to stand out, but you got to think on your resume. How can I make myself look good, even if I have no experience? I have no experience, but I have all of these skills. I have all of these skills, and I have a positive attitude. So that is key, because a lot of times you'll get people who will get discouraged right away in this hiring process time, right? Or trying to find a job. They'll get discouraged because, Bleu, I don't have experience. I can't find a job. Go to the temp agency. Go to the temp agency and register with them. Well, no, Bleu, I really want like a full-time job right away. I said the same thing. But then when I said, okay, well, this is a thing I haven't tried yet, because for 2 months I was like searching. I put out lots of resumes, and I got calls, and I got these tests, but they were like, well, we have a thing at our facility about hiring new coders, which I think is stupid. And I hope the culture changes on that. But in the meantime, I said, okay, I will go to the temp agency. Within a week, I had a job. And that lasted for 3 months. And then as that job ended, I was offered another job that was supposed to be more permanent. Okay. But I was only there for 8 months before I had applied for another position, and I ended up getting it. So, and it was not with the temp agency. It was a full-time permanent position with a large hospital that I am very proud to work for. So that is something that you have to be able to take a few steps back, or try to get into a different position, like an alternative position, either through billing or through medical records, or even release of information, because you've had HIPAA training, right? We all had HIPAA training when we were in medical coding school, or even if you're studying on your own, you can still study HIPAA, all right? So that is something, that's another one. Release of information will not get you coding experience, but it will get you around the people that are going to be hiring for coders, because you've gotten yourself in, right? You've gotten yourself into the facility. Now, of course, there are instances like with the viewer who had somebody who doesn't want her to transfer, and that does unfortunately happen, but not all the time. Sometimes there are employers that be like, okay, fine. Thank you for being here. See you later. So that is, you're in, and it's a lot easier to transfer in-house than it is to hire somebody on the outside and have to do all of that with the background check, the fingerprinting, the substance tests, and things like that. So, hi, Ellie. It's okay. Thank you for the blue heart. Tangela, thank you. CB, Bleu, you did a video where you said that AAPC tests cannot be taken without experience or school. But wait, what? I did what? You said that AAPC tests cannot be taken without experience or school, but Ahima can? You also said that you weren't sure. I'm just curious to know if you ever confirmed that. I think you need to give me that video, because I don't recall ever saying something like that, unless that was a really old video. But no, I don't think I ever said that. The AAPC test can be taken without experience. That doesn't make sense to me, because a lot of people who take the AAPC test have never been a coder before. But the school, the thing I may have said that maybe was that I wasn't sure about the school. That you, what did you say? Sorry, maybe I misunderstood you. Yeah, I think so, because at the time I used to think that AAPC required a school, like you had to go to a school. But then somebody told me that you didn't need to go to an actual school. You didn't need to go through a program for AAPC. You could just pay your membership fee and then take the test. So it's like, oh, okay. But yeah, you don't have to have experience to take a test. So if you can leave me the link to that video, that would be great, because I definitely need to go back. If it's something that I said, that I need to go back and either, put the video on private, or, do something to it, because I don't know, like all of a sudden my vintage videos are coming out. People are watching my older stuff. I'm like, why are they watching older things? But yeah, so Yeah, no, you can take the AAPC test without having experience. I don't think I ever said that. So, but yes. Let's see what else. Tawana said, to come back to Tawana said, this is my second week of coding school. So far, so good. I am going to get my CPC, but I only have experience as a medical assistant. Will it help me get into employment into coding? Okay, the great thing about being a medical assistant or having prior experience in medical is the fact that you have had exposure already to the medical field. All right. However, I will say that when you start to do your resume, do not make it sound like you want to be a medical assistant again. Okay. So I don't want to see details about like that you prepped, like medicines and things like that. Don't start talking about that detail. Start talking about the other things that you did. Did you have to document like their weight and things like that, and the BMI and things like that? Where were you a medical assistant for? Was it like for OBGYN, or was it for like a podiatrist office? What specifically, what specialty specifically? And you got to be able to put that to your resume, because that's going to say, okay, this person has specific knowledge about this particular specialty. If it was multiple, then you need to list them out, because they don't know you from Adam or Eve, and it looks better on your resume if you can say specifically where you worked at. Even if you were a floater and you worked at different places, at different specialties. So go ahead and put that down, because again, that means that you understand you have knowledge of that particular specialty. Think about all the things that you did. Think about, okay, well, if you did medical assisting and you also helped to collect the like the co-pays and stuff like that. If somebody was out, that I've seen where somebody was like, well, I did medical assistant, but I also helped out in the front desk when somebody wasn't there, and I collected co-pays and things like that. That's another thing that you can put onto your resume. So make your resume reflect what a coder would do with all the skills that you've gained as a medical assistant. So that, if that helps, at least I think that would be a good way to put it across. Because again, you don't want it to make it look like you want to be a medical assistant again. I see that a lot with my nurses that come to me for resume reviews, and they say, well, here's my resume. And then when they give me their resume, it looks like they want to be a nurse again. And I tell them straight out, looks like you want to be a nurse again. Well, no, I want to be a medical coder. Okay, let's talk about how we can get this experience to look like coding. Okay, what did you do? What did you document? What did you, you had to protect patient information. HIPAA, okay, again, that is what we do. We strive on privacy and confidentiality. Again, that's what a nurse does. That's what a medical assistant does. You are being responsible with this information. So again, on your resume, that is what I would recommend for that. Again, even though you've had experience, this is what you did. You need to take everything that you can and transfer it over to what a coder would do, and all of your knowledge then. So yes, but that's what I would have to say about that. That's my advice there. And let's see, did I miss anything else? I hope that helps, Tawana. Okay, I did medical billing exam and I have passed, but looking for work now, and everybody's asking for 2 to 3 years of experience. So what should I do? When you are brand new, again, is going back to how does your resume look? Are you applying for the temp agency places? Are you still applying anyway, even though they're asking for experience? Karina, have you looked into programs like if you are coming from a low wage paying job, or if you are coming from a background where you've been laid off, at your local workforce office, your state workforce office, They do have programs there. There's a program called the WIOA, the Workforce Innovation and Opportunity Act. Now, that was how I got my school paid for. And so what happened was I was laid off. I went to the employment office because I was on unemployment because I was laid off. And so while you're there, they give you all kinds of classes. So they do ones for resumes. If you need a GED, they'll help you to get your GED. They'll help you with interview skills. And one of them was for going back to school. And so they had this program called at the time it was the WIA, Workforce Innovation Act. And now it's Workforce Innovation and Opportunity Act. Okay, so the name was updated. But the program is still the same, right? So they had lots of different professions that you could choose from. So you could be a truck driver, you could be an accountant, you could be a beautician, you could be or a barber, and you could be a medical coder. And I was like, oh, well, I said, well, I'll do accounting because, I like numbers. I can work with numbers. I have no problem doing that. And I can do people's taxes. I can work independently. I was like, okay, yeah, I'll sign up for that. So when I got with my case manager, he was like, oh, yeah, well, what about medical coding? And I'm like, no, I don't work with needles. No. And medical assistant was another one, too, that you could do. And I said, I don't work with needles. And he goes like, well, no, it's reading. And I was like, well, I like reading. And he's like, yeah, it's just reading. And he goes, check out the schools. You got to interview 3. He goes, but just go and see what you think. He goes, and if you like it, great. He goes, if you come back and tell me, I don't want to do this, that's fine. He goes, I'll get you in the accounting program. He goes, but just try it and see. And I'm like, okay. So I started going to these recruiters at the school because I had to go through 3 and I had to pick one. So the first 2 schools were like, oh yeah, you're going to make all this money. You're going to be able to work at home. And I'm like, no. I don't like the way this sounds because it sounds like it's a sales pitch, right? And I was like, okay, no, I'm not going to do this. And so the third one, she's like, what do you know about medical coding? I'm like, nothing. I said, my case manager sent me over here and what I've been hearing is like, it sounds like a sales pitch. She goes, what we do here, she explained the program. She explained what I was going to learn. She explained that there was 2 major medical coding associations. She told me the difference between the 2. And she says, our program trains you for both. You can sit for either one when you get done. We will not give you a diploma when you complete your program here because we want you to get your certification. So you can decide whether you want to go with AAPC or you want to go with Ahima. And so I was like, okay, well, I ended up choosing Ahima. But that was a school that I picked because at the end, she tells me how much medical coders start off at. I was like, oh, okay. So this wasn't a sales pitch about money. And that's my motivator. I don't need to be motivated by money. I need to be motivated by, am I going to enjoy this? Is this something that I'm going to want to do? And when you tell me that I can get paid for reading all day, I'm like, because I like to read, I have never been laid off to be able to apply for that. Again, like I said, it's even if you are in a low wage paying job, just go to your workforce office and see if you qualify. There's a lot of people that don't know that they qualify for this. You can also study on your own. You can go through my independent study video and I give you all the books and there's all the links and there's free resources on there as far as like for study and things like that. You go through there, you study, you take 9 months to study, you take a year to study, because if you're going through the independent study program, like I have it laid out, it'll take you 9 months. Okay, that's the shortest you can go. You can go faster than that. I don't recommend it. But you can take up to a year to finish it. To me, it's always better if people take 9 months, 12 months, or 18 months to finish a program. But again, if you're doing the independent study video, or you're doing the independent study, it has all your books there, everything that you need. And so all you have to do is buy your books. And I always list the cheapest books. And then you pick which association you want to sit for. You pay for your certification exam and off you go. So you don't have to go through a program if you don't want to. But like I said, try to go to the workforce office and see if you qualify. And if you qualify, then you don't have to pay for nothing. I didn't have to pay for anything. I had to pay like $99 for my test, and that was it. That was it. They covered the other part of it. So I got into this for $99. And I have a career that I love. That's it. CB, Blue, why did you choose Ahima? Was there something that appealed to you more than the other agency? Okay, so why I picked Ahima. I picked Ahima because in my city, my hometown, where I went, I looked at the job listings, which was what it was recommended to do. Look at the job listings and see what certification are they asking for a lot. Which association do they want? At the time, it was Ahima. Everywhere I went, it was Ahima dominates a lot in that area. They still do. And so I was like, okay, well that to me is okay. And then I had looked at AAPC and I looked at some of their practices and I'm like, And it wasn't, and guys, do not misunderstand me when I'm saying this. I am not saying that one is better than the other. I have never said that. I will never say that. And the only reason that I tell you guys that I picked Ahima was because at the time, what I knew of medical coding was this is the association that they're asking for a lot of. And I'm like, okay, I can do this. And so that was why I chose that way. And so I just hope people don't mistake what I say and say, oh, well, no, because since the beginning of my channel, I have always been very clear. You have your choice. I happen to pick Ahima because, again, that was what dominates the market in my hometown. And for some people, they say, well, everybody around here asks for AAPC. Well, and where I live now, everybody is AAPC. I am one of a handful of people who has an Ahima credential or designation. So that tells you, like, there's less than 5 of us at my hospital. Everybody else is AAPC. And the way the story goes with that is nobody was certified at all in medical coding before I got here, right? And it was about a year before I got here that one of the ladies that was a supervisor at the time, former drill sergeant, who was my my supervisor when I got here, she had gotten certified, and then she was the supervisor for the HIM department. And so, okay, well, all these coders are here, and they've been working as coders, but nobody's certified? And they were like, no. So she actually got everybody certified with AAPC. They went through classes all together and things like that. So she got everybody to get certified with AAPC. And because that was a program that she knew, because that was who she got certified through. And so that was how everybody else got their certification. She elevated their level of education just by encouraging them, hey, if you want to take this seriously, you've got to get certified. And so a lot of the girls were scared. They're like, well, I haven't taken a test and, I haven't done this and I haven't done this in years. And so she was like, no, you guys. And a lot of these ladies were in their late 30s, early 40s when I got here, the late 30s, early 40s, and they had gotten their certifications. And so they were like, oh, a lot of them were really happy when they were able to take their test and pass. And then another reason was because if you failed, you could retake it again for free. And that was some of the things that she had said too, because if you get nervous, it's all right, you can do the free retake. So when I got here, of course, I stood out like a sore thumb, because it's just like, you're with Ahima? And I'm like, yeah. And they go, well, why don't you get AAPC certified so you can be like the rest of us? I'm like, why would I do that when my certification says I can code both inpatient and outpatient? And your certification says you can code only outpatient. Why would I give it up? I don't. And then they were like, well, and so I've always stood out because I have Ahima credentials and everybody else has AAPC. So, and at the time I had the CCA. Now I have the CCS-P and the CCS. So it's okay, Rebecca. Thank you for the blue hearts. But yeah, that was why I chose Ahima. So again, both credential agencies are great, and I always recommend both of them. So, Yelena, Good evening, Blue. I want to thank you so much for all your wonderful videos. Oh, thank you. You created. You are such an inspiration and support to new coders. I passed my CPC in July 2020 and was working as insurance verification specialist. Oh, thank you, CB. Now trying to get a coder job, which was such a challenge. Keep improving my resume, but I see on Indeed insane competition from 7 to 1,500 applicants for one position. So again, when you're looking on sites like Indeed, right? Now, Indeed is paid. They are paid. This is not a free site for these employers to be able to post on. So while there may be lots of applicants, sometimes I think maybe it might be a little bit marketing there, and to kind of get people to encourage people to apply. And oh yeah, if you post on Indeed, you're going to get lots of applicants. So I don't know. I don't know. I'm just thinking. Maybe is it? But I would not get discouraged by that. There's going to be lots of applicants. There's always lots of applicants, but you have to make your resume look good, and you have to be detailed, but you have to be to the point. You can't be having whole sentences in your resume. If you have, well, I did this and this in addition to, as part of one of your bullets for what you did for that particular job position, again, that's too many words and they're going to dismiss you. If you're not listing your skills like Icd-10-Cm, CPT, Hicks, PICS, evaluation and management, that you know all of this stuff, it's not gonna make you look good, right? Because they don't know what skills you have. And even if you think, well, everybody should know about coding, I have my certification, they should know I know how to code, they don't know. And again, they're looking for those words when they're sending these resumes through this scanner. They're looking for everything that they asked for in their job posting. People ask me all the time, well, Blue, what are employers looking for? It is literally right in the job listing. It's their wish list. Their ideal candidate has these skills. CB says, true, Yelena. I'm trying to keep myself from desperation. I know it is not a sprint, but a marathon, and to keep coder skills fresh and look for a job. Also, I am debating on taking a CRC certificate, but not sure if I should. All right. So you don't have a job yet, Yelena, right? As far as like in coding that you want, you have your CPC, but now you want to add another certification and you don't have a job as a medical coder yet. Again, when you add on additional credentials, it does not get you looked at quicker by employers. Before, if you were looking at a risk adjustment job ad, they didn't ask for certification. A long time ago, right? And a long time ago being last year, they did not ask for a certification at all. Now, all of a sudden, the CRC is a very hot credential and everybody should get it. That's just me being, I didn't say to get it. What I'm saying is this. Now, employers are kind of looking at it because now they realize, which I don't know why, and I even said it back then, why would you hire somebody who does not have pathophysiology knowledge to be in a risk adjustment position? You need to know the disease process to be a risk adjustment coder. So again, if you're wanting to go that route, a lot of times when you see these, they are willing to accept a CPC. They say sometimes it is preferred that you have a CRC as well. But again, are they going to pay you more money for that additional credential? No. What they're saying is they prefer it because they know that you've had the training for the risk adjustment, or that you have further understanding of the risk adjustment part. But again, if you have your certification and you still make your resume look good, you still make your resume look very polished, they can still take a chance on you having the CPC. So that would be my suggestion, is don't go getting all these additional credentials when you don't even have the position that you want yet, okay? I have seen many people make this mistake where all of a sudden they have a CPCA. I'm not saying that you have a CPCA, but I have seen people get a CPCA, a CRC, a CPMA, and a CPB. They have all these credentials, and I'm like, what are you doing? They're not gonna pay you more they're not going to call you back faster. Well, I'm just trying to get a job. Concentrate on getting in. You got to be able to concentrate on your medical terminology, your anatomy, pathophysiology. Concentrate on that. Seeing all these credentials when you don't have experience, that's the key, folks. That's the key. Having all these credentials does not mean that they're going to call you back right away, because they're going to expect experience with all of those additional credentials, which is the heartbreaking thing, is that these credentials are being sold to people that, oh, if you have a bunch of credentials, you're going to look so much better than somebody with one credential. Really? Oh, okay. Challenge time, right? So then explain to me why before this year, because this year was when I got my CCS-P and my CCS, please explain to me why since 2008 I've managed to get not one, not two, not three, but 4 jobs. And each time, each one of them paid progressively better than the other one. Explain to me why when I only had one credential. And I'm competing with people who have their degree, RHITs. I'm competing with people with multiple AAPC credentials, still with my one CCA. Because again, it is not on the amount of credentials you have, it's the caliber of the coder. So concentrate on building your skills before you try to get an alphabet after your name. The only time you should get an alphabet after your name, friends, and I'm telling y'all this from the bottom of my heart, the only time you need to get an alphabet is when you've had experience. And you can say, I have years of experience. This year, I got not one, but 2 credentials, the CCS-P and the CCS. I have experience since 2008, and not just one clinic. I have experience in many different settings. So that's the difference between me and somebody else who has a bunch of different credentials with no experience. So what I did with my one credential was I concentrated on learning. You got to concentrate on learning. You got to concentrate on getting more proficient with the book. So that is what I would suggest to you. And that is what I've always suggested. People don't buy that because they think if they spend more money, they're going to be able to make more money. That's not true. That is not true. And so that is just my advice there. If you're going to go that way, invest in classes that are going to help you to learn and be more proficient. Because when you're taking these assessment tests, they're going to expect you to know this stuff. If you can't pass those coding assessment tests, you're not getting a call back. So concentrate on that. Concentrate on passing those tests before you start adding. Good night, Ellie. Thank you for the blue heart. Yelena, can I say I have 1 year experience if I study coding in college and while participating in the CPC certification? No. In order for experience on your resume to count, you have to be under production standards and accuracy standards. That is the only way you're going to be able to have experience on your resume. And even if you've done Practicode, sometimes people think, oh, well, it's 1 year of experience. So with AAPC, they had the apprentice status for their CPC and their COC certifications. And in order to remove this apprentice status faster, because it is a 2-year time commitment, in order to remove this status faster, they do have a program called Practicode. And you code over 660 records, right? And so real world redacted records without the multiple choice. And so you're basically going through and you're supposed to get more confident with your coding skills. Okay, it is a great educational product. And they say that it takes 1 year off of that 2-year time commitment. And so sometimes people say, well, I could put that as 1 year of work experience. No, because again, you're not under production standards, you're not under accuracy standards. That is an educational product. There are some employers that are willing to take education in lieu of experience. So you got to watch out for those words too. And if that's the case, then that's okay. But you cannot say that you have 1 year of experience just because you've been in school and you've been studying. You can't say that. Yelena, thank you so much for your advice. Sarah, thanks, Blue. See you tomorrow. 25 days of modifiers. Thank you for the blue heart, Sarah. Yes, tomorrow starts. the first day of Vlogmas, 25 days of modifiers. So I hope you guys don't get sick of me. And I hope you guys watch those videos so that you can, it'll help you to understand them. Because sometimes I think if you have somebody explain them and you have an example, it does kind of help with the comprehension versus just trying to read it. At least that's just my advice anyway. So, but yeah, that is what I would recommend. And Yelena, you got to watch the details, like my name, BLEU. And so even when you're encoding, even just having one number or one letter off or switched around can completely change that code. So make sure that you watch those things, okay? And looking at what you have in front of you and being able to comprehend this stuff, that it goes a long way, okay? That's just my advice anyway. But yes, that is what I would recommend for, looking at those things. It's okay. But don't look at the competition that you have against you as far as like, oh, these other people have experience and that kind of thing. They have their skills, yes, but so do you. And not everybody has the same experiences either. And so that's what's going to set you aside, and if you have to keep applying. Apply for the places that are asking for experience anyway, because a lot of times if these employers are looking in areas where people are already working, if a medical coder is happy where they are, they're going to stay there, so the employer is just going to get stuck with whoever applies. Well, if you are a really good brand new medical coder, think about this. You don't have any bad skills for them to untrain. That's the danger with veteran coders, is that, once you leave the place that you've been working at for years, you have to relearn, and it's easy to fall into old habits. So that is something that you have to think about, and that is something that you can say too. I don't have any bad habits to break. Who better? Somebody to train. This is somebody who's brand new and can think independently and is a blank canvas for this new employer to work with. At least that's just what I would say, I would hire brand new coders all day long, but here's a caveat. Here's what I would do with new coders, brand new coders. Oh, you want to work? Okay, pass this test first. If you can pass this test, okay. If you can at least get an 80% on that test, good. That's something I can work with. If you can't pass the test, then that means you either went through a very fast-paced medical coding program, or you're going to really need your hand held. If you really need your hand held, again, like I said the other night, and I think I said it earlier today too, nurses have a expression that they eat their young. Medical coders do it too. And I am not that way because I am very supportive of new people. However, you get into these hospitals and you will see these HIM people, they will be mean. And these other coders, they will not help you. And well, how am I going to get training? When I first started here at this hospital and I was working for the drill sergeant, she's a retired drill sergeant, I should say. She said, there was another lady that started after me and she wasn't as experienced as me. And so she said, when do we get training on the coding? And she says, no, you passed your test. You know how to code. This is not the job for you if you need somebody to train you on how to code. We will train you on our systems, but I'm not going to train you on how to code. You need to figure that out. And so that is a reality among brand new medical coders, is that they think that they're going to learn on the job. And that is the fault of the school a lot of times, because even I was told that in school. Oh, they'll train you on the job. And I never kind of believed that. I never wanted to fall into that trap because I was just like, no, I need to know. So they will train you on their systems, but not on the coding. So you have to be willing to actually dig in and study. It doesn't stop just at the certification exam. Oh, no. No, it does not stop at the certification exam. This is constant. Taking 2 exams this year, I'll tell you, even somebody who's a veteran coder with all these years of experience since 2008, I'm still studying, still trying to learn, Kung Fu Ken, in my experience, so far as new coders, my coworkers are extremely helpful and nice to me. There you go. So it's it's different everywhere, but don't expect for people to help you, because that's the attitude of a lot of people, that they expect to be helped and they think they're going to be helped, and that's just not the case sometimes, you know. But of course, there's always one who tells me, oh, yeah, the opposite. Yes, I know that. But again, I want people to be prepared when you go into this job. Okay, I may not get the training, I may not get somebody to show me the way. So I need to be prepared. I want people to be prepared rather than to be ill prepared, because I see a lot of people, and especially on LinkedIn, that they feel entitled to have people help them, and no one is entitled to be helped. Okay. Is it great when people are supportive? Yes, this is why I have my channel. This is why I do what I do. This is why I want y'all to be prepared. But at the same time, you've got to do some of the work too. It's like yesterday when we were going over this, I carried this conversation. And when we were talking about this book, a lot of people were saying, oh, yes, they're very excited about it. Yes, they're very excited, but you guys did not ask questions. And I had to keep reminding you guys to ask questions. And I had two. Two from the audience. The rest of it I did. So again, when you're studying, you need to be able to ask questions. When you are in a study group, you need to participate. When you are in any kind of training like that, you need to participate. And don't just let somebody else to ask all the questions, because they may not ask what you need to know. Okay. And if you feel like, oh, I don't want to look stupid, then this is not the field for you, because there's going to be a lot of things that you don't know. We have to know what doctors know while never having gone to medical school. That's how much knowledge we need. That's how much knowledge we need. So I want you guys to think about that when you are out there in the real world. Ken says, even when I was in the hospital as medical records tech, as release of information, the coders would give me a lot of helpful tips into coding. I think I was just lucky. Yes, you were, because that is not the way that it is. But you know what else it is too, is that you're a guy. So there's a difference there too. And before anybody says anything, think about this. Men are they're in the minority in medical coding. Do I wish that there was more men to balance out these departments? Absolutely, because I think it needs to be more balanced out. But because you stand out, that may be why you got so many people helping you. Again, it really all depends on the environment. But again, it goes back to what I just said. I want you guys to be prepared. I'm not going to give you guys that, oh, yes, everybody's going to help you and you're going to get a lot of support. Because when you see what happens when people get out there in the real world, you'll have the people who had help, and then you'll have the people who did not have help. And you'll see both sides. So again, I just want you guys to be prepared. So, but yes, so that is what my topic is about today. So, but yeah, if you are out there and you got lucky, then you got lucky, you know, but don't expect it. Okay. Just like the same thing, like with people who get jobs easily. There's some who got their first job within a week of graduating. And there were others that weren't so lucky, and they, for whatever reason, they slipped through the cracks. And sometimes they have to wait a long time to get a job. So, Andrade says, yes, that's not the way that it is. No one wants to help. And actually, I was told that I needed to learn on my own because they themselves didn't have help. Thank you. Kung Fu Ken, it's true. When I was in my RHIT program, it was also 80% of women and the rest were men, I think that you meant. And now my office is probably 90% women and 10% men. So there you go. Again, I do think that there needs to be a little bit more gender equality here, because I've had men who say, well, Bleu, can a man get into this? Because I think that, you know, these places would only hire me if I was a woman. No. That's not true. If you're a guy, you're going to stand out because, you know, it's to balance out these departments. That's what it is too. And a lot of times, even when you're working with these doctors, sometimes these doctors have a hard time listening to women. So if they have another man to go in there and try to work with the provider, then sometimes they'll work with the man better. It really all depends on the individual. But then again, it depends on the approach of the woman. It depends on the approach of the man. So there's two ways of thinking about it. So again, I still think that this is a field that is going to grow for men, just the same way that nursing grew for men too. Because for the longest time there was no male nurses, and now male nurses are coming up in the field. And so that's a good thing. I think it's good when you have professions that can balance out, is particularly ones that are office related. So that is what I would say on that. But yes, if you're a guy, don't be scared off. And there, I've had other ones. They say, "Well, Blue, I'm a guy, and I thought I wanted to do this, but there's too many women, so I'm not going to do it." If it's that easy to scare you off, then it's probably not for you anyway. But you shouldn't be scared to do this. I mean, it's such a rewarding field, I've found. But that's me though. And when you look at the longevity and the stability of it, it's there. Because even when the pandemic hit, look what happened when the pandemic hit. There was a lot of people who were in jobs that you would think would never go away, right? They would never be out of work because they were dishwashers, bussers, waitresses, waiters. And so then all of a sudden, what do we see? We saw all of that go down to a fraction, because now they're working in the drive-through because everything is shut down and now everything's opening back up. But for the longest time, it was like, there's people who did that for years. And now what do? The one field that did not have a problem and the one field that was actually hiring at the time was medical. So that is something that, you should think about too, because again, we're always going to need medical. We're not going to get to a point where we don't have disease in the world. We will always have disease in the world. We'll always have conditions or the need for preventative care and things like that. So we're always going to need that, At least that's just what I think. Anyway. But yes. But absolutely, Andrade, that's the thing. There's going to be people out there that will not help you because no one helped them. I do not believe in that. I believe in helping. I would probably been one of those people who helped Kung Fu Ken. However, I would have also been one of those ones who helped Andrade too. And I would have been like, no, I'm here to help you, because that's what I do. I had a coworker who I used to work with before I got here to this facility. And we worked together at the facility that I was at before. And so I was here about 6 years, 7 years. And then she showed up, and she had been at the other facility. But when I got her at that other facility, I was a brand new coder myself. Again, I didn't have very much experience, but I shared with her what I knew, which she suffered a lot because she didn't have any hands-on teaching. She went through a fast-paced program. So I taught her everything I knew. Well, a lot of the things that I had taught her, the first thing she did when she saw me, she's like, "Oh my gosh, Blue, I've been meaning to tell you." She's like, "I did this and I did this, and you remember when you taught me this?" And I'm like, "Yeah." And then she's like, "Well, I still do that." So, that's what you do. I mean, to me, I've always loved to teach. I love to do that. I love to be hands-on. And that's something that's what I like to do. So, But when you are a brand new coder, just prepare yourself. I want you guys to be prepared. I'm not going to give you the sugar-coated candy thing. And if you end up with that, great. If not, then you were prepared. And I would rather prepare you for battle than you be really shocked. Because I'm the one who gets these emails from these disillusioned people. "Oh, I thought this was a lot easier than what it was sold to me as." Ken, I taught music for a little bit and would like to teach coding in 10 years. See, that's awesome. Giving yourself time to have experience. That's amazing. And that's really good. Because we're always going to need music and coders. So, but yes. So is there any other questions tonight before I wrap it up? Mahogany, thanks so much for sharing your knowledge and experience. You're welcome. Yes, I hope it helps. And if you found value, I hope you hit the like button, because you know YouTube likes their likes. And I'm going to be doing 25 days of modifiers starting December 1st for Vlogmas. It's going to be a short message every day for the next 25 days. Plus my 5-night-a-week show. Although I may take Christmas Eve off. I don't think anybody's going to be on anyway. Plus I'll have the 2 shows for Christmas Eve and Christmas Day for Vlogmas. So, you know, anyway. But yes, I'm going to go ahead and wrap this one up. If no one has any other questions. Tomorrow, what is tomorrow's show going to be? Well, y'all are here. So it's going to be my experience with a temp agency. A good time to talk about that, I think. But what it was like to work at a temp agency as a medical coder. So hopefully that will encourage some of you that are out there looking for a job to register with a temp agency so that you can get a chance of getting in somewhere, because all the assignments that you go on, they're going to be filler for your resume. And it's better to have some experience than 0 experience, because you never know who you're going to meet. Okay. And that connection that you make from those temp agency jobs, you never know. Hi, Rochelle. Thank you for all the blue hearts. All right. So I'm going to wrap this one up. Thank you guys so much for joining me, and I will see y'all tomorrow. Bye.